Chapter 3, Patient Preparation. So today we're going to talk about different things with patient preparation. So requisition review, we have physicians, PAs or physician assistants, our nurse practitioners. They are all going to be responsible for ordering lab tests. We cannot accept any orders from any other healthcare providers unless they're authorized. So that's something that's really important to remember. If somebody other than them, those three, come up and say, hey, draw the blood on so-and-so, we shouldn't be doing that without having that order. A requisition form is going to be the form that lists all the specific tests that the provider wants you to draw, so what they ordered. And so that's going to be, where we learn later down the road, okay, these tests are ordered, which color tubes do I need to use? And the form should also include the patient's full name, their date of birth, whether they're male or female, and then their medical record number as well. One thing to remember too is we always need to examine that requisition form. We need to look it over really well, make sure everything's correct on there. We need to verify that the tests that are ordered comply with the appropriate testing times. It will have specific precautions or concerns on it as well. So another reason why we need to look it over real good, if the patient has allergies to latex, we need to see that, okay? If the patient tends to faint, just maybe at the sight of needles or as you're inserting the needle into their vein, if they have excessive bleeding, different sites that you may want to avoid. All of that is really important, and that should be on that requisition form, so we need to make sure we're looking at that. You must understand which tubes the blood's going to be collected in, and then determine the correct order of draw. We'll learn later down the line that the tops of the tubes have different colors, okay? And each one of those colored tops are for certain types of testings that the doctors are ordering. So we'll have to learn that and be familiar with that when we're actually on the job, so we make sure that we're drawing the right thing. Specimen labels are really important. They are going to accompany that requisition form. They're going to be electronically generated, so when that requisition form gets printed, a sheet of those labels will get printed as well. It's going to have the patient's identifying information on there, so the patient's name, birthday, medical record number. It will have the date and the time on there as well, and those are going to be placed on our blood tubes after draw, or whatever specimen we're collecting. Our initials should be put on there as well. And then we're going to need to make sure that the specimens are labeled immediately after we draw, right at the patient's bedside. Okay, that's really, really important, because we don't want to draw those blood tubes, carry them on our cart, go to another patient's room, draw their blood, and then now we're like, oh, I didn't label them, so which blood goes to which patient? That can cause a lot of issues. One being, if one patient's blood comes back, that something's bad and they need medicine for, and we have it mislabeled, the wrong patient's going to get that treatment, which means the right patient isn't going to get treatment. So that patient could get worse. We could cause problems by giving the patient something they don't need. So it's very, very important we label those specimens immediately after drawing or collecting. So again, patient identification, we talked about this the other day, is very, very important. It is a very crucial step to the whole process. We always need to verify that we have the correct patient, and by doing so, we are checking the patient's name band, we're checking the requisition form, and then we're verbally having the patient state their full name and date of birth. And that is, we need to do that with every patient. And unfortunately, if we draw blood on this patient, let's say at 2 o'clock, and we have to come back in at 6 o'clock to draw that same patient again, we need to do the same thing. Okay, we need to make sure their requisition form, and we need to have them state their name and birthday again. It's just kind of covering our butts, because again, we don't want to draw blood on the wrong person, because then we're delaying testing and those types of things. We want to greet the patient before beginning the collection. We never want to just, go in, get everything set up, and then grab for their arm and start drawing. We want to interact with them. We want to greet them. We want to introduce ourselves. Tell them what you're going to do. Even if they've had their blood drawn a million times, we need to just we need to tell them what we're doing, greet them, and those types of things. We want to also introduce ourselves. So identify yourself, tell them your name, tell them that you're the phlebotomist, and then again, go through what are you going to be doing today. The doctor ordered so-and-so tests. I'm going to draw your blood. Make them feel comfortable. A lot of times these patients are going to have some anxiety. They're going to be scared, those types of things. So if we can, by introducing ourselves and kind of talking to them a little bit, we can, ease that anxiety a little bit. Obtaining consent is really important. So before we collect a specimen from a patient, we must get that consent. So informed consent would be the patient has the full information about the procedure, such as the risks, that it's an invasive procedure, maybe surgical procedure. An express consent, that patient is going to give that consent to you either orally or in writing on a consent form. Normally, we're going to have those patients sign consent forms. When they're registered, that's usually when they sign that paperwork. Implied consent would be like the patient's actions show that they're giving you consent. So as a phlebotomist, if the patient extends their arm out for a venipuncture, that's that implied consent. Implied consent also is in effect in those emergency situations. Maybe your patient is unconscious or whatnot. So we assume that if they were conscious, they would want us to help them. And so that would be that complied consent as well. Implied. Consent for minors can be a little bit different. Most cases, that parent or guardian is going to give the consent. There are some exceptions for teenagers, such as those that are married, if they're supporting themselves and a dependent, so they have a child, if they're in the military, or if they're emancipated by court order. Remember, if a patient refuses to give you consent for any reason, then we cannot go on with the action, or for us, the specimen collection. Some of the tests that we may collect are going to have pre-collection requirements. Sometimes the patient must fast, which means for a period of time they're not going to eat or drink anything but water or black coffee. Usually that's going to be a 12-hour fast. Sometimes medication administration. Maybe they need to take medications prior to. Maybe they need to stop taking medications before. They need to avoid specific foods or drinks. And sometimes we have a specific time of blood collection. We might come across patients who have not done what they're supposed to do prior to collection. So it is very important that we ask if they've done their pre-collection requirements. If they have not, then we need to wait to draw and contact whoever made that order, so the physician or the nurse practitioner or the physician's assistant, and see if they want us to draw, if they want us to reschedule. Always review testing requirements. Again, that's so important. If the test has to be rescheduled, be sensitive with the patient, because sometimes they may become angry or upset. But again, we just have to be sensitive with them and explain to them that if we drew it, that the results may not be accurate, and sometimes we can calm them down with that. Again, fasting, no eating or drinking anything but water, and a lot of times they're okay with black coffee for that 8 to 12 hours prior to the test. Whoever ordered that is going to tell the patient, that required time that they need to fast. Again, with medications, some tests are going to determine the effectiveness of a medication. So sometimes medications should be taken at a predetermined time. They should have it written down when they last took the medication. And again, sometimes they may want them to stop taking the medications as well. With the basal state, so it's going to be based on the patient's lifestyle and just their overall condition. Typically, that's going to be collected first thing in the morning. So again, no eating or even exercising for 12 hours. And then that's really looking at the reference ranges as well. Once we determine that the patient has met those pre-testing requirements, then we can proceed with the blood draw. We want to ask questions again to prevent or manage complications during the collection. Do they have complications when they have their blood drawn? maybe fainting, dizziness, anything like that. We definitely need to check for allergies, especially to supplies and equipment. Latex is a big one. Not many places use latex products, but occasionally we may have something that is. So knowing that is really important. Another thing with us, with phlebotomists, is tape. A lot of people are allergic to the adhesives on the tapes and the bandages. That's one thing with bandages. There are a lot of bandages that are still latex. So we really need to check that latex allergy. And then again, with the fainting or passing out, we want to know that ahead of time so we can be prepared for that, so we're not caught off guard if the patient does faint. And really engage in conversation with your patients, like I said before. That's going to make them feel a little bit more at ease. And hopefully we can make that blood draw go well for the patient and for us. Choosing the correct location for the draw is really important as well. Look for patients with mastectomies. So if they've had their breasts removed, usually from cancer, if they have central venous lines, arteriovenous fistulas or shunts, intravenous infusions. Look for injuries, rashes, any surgeries. Those are really important. Again, somebody who's had a mastectomy, we cannot draw on that side that was affected. And again, with fistulas and things as well. If people are going for dialysis, we don't want to disrupt a limb that maybe they're getting ready to have a fistula or a shunt placed. So just things that we need to look for. And again, ask about those medications they might be taking, both prescription and over-the-counter as well. Patient education is just as important as the actual venipuncture itself. Just explaining to the patient what's going to happen and be honest. So especially when you're drawing children, don't tell them that it's not going to hurt. We need to be honest with them. Tell them that it might hurt a little bit. They're going to feel a pinch, those types of things. Especially with first-time venipuncture patients where they've never had their blood drawn before, which is normally going to be those children. We need to be very, very honest with them because we don't want to lie to them and then something happen and then, every time they get their blood drawn, it's a bad experience. We need to be aware of complications. We need to be looking for them, but we also need to tell the patient about things that could happen. Excessive bleeding or bruising, pain or lack of sensation, signs of infection, things like that. Hopefully none of that happens, but we still need to make sure that the patient is aware that it could. Positioning your patient is important. We want them to be comfortable. We also want to be able to access so we can get a good draw. Priority and goal is always to keep our patient safe. Always have your patient sitting down or lying down when you're drawing. Never let somebody stand while you're drawing, even if they insist, because if they do get dizzy or faint and they fall, they're going to injure themselves. So we want them in a comfortable position. Again, we need them in a position that we can draw, but we want them to be comfortable. And have them at a good working level because we really need to think about our backs. We don't want to get back strain and things like that if we have to hunch over. So we want that good working position as well. So as we talked about, I believe, last week, blood vessels are going to consist of our arteries, our capillaries, and our veins. Venipuncture is where we are accessing the vein. There's 3 veins that are accessible in the antecubital fossa, which is that bend in your elbow. Okay. The most ones often used is the median cubital vein. That is usually going to be always our first choice. It's going to lie near the center of the AC. Again, that area of the bend of the elbow. Less prone to injury, less painful, and in some patients, especially obese, the vein might not be visible, but often can be palpated. So even if we can't see it, we can usually still feel that vein, especially in those obese people. The cephalic vein is going to be our second choice. It's going to lie in the AC on the lateral aspect of the forearm. It's going to be a very large vein, again, easily palpated. Usually not visible though, and that one is going to tend to roll, so it can be kind of hard to stabilize that vein. I will show you next week some different ways that we can stabilize veins so we don't have them rolling on us. The basilic vein, that is going to be our last choice. It's going to lie in the medial aspect of the forearm. Again, it's going to be a large vein, but it is very close to the brachial artery and very close to the median nerve.